today to introduce you to this session. I'm hoping today will provide an introduction to hypermobility, so exploring what it is and how it may present in children. So it'd be great in the chat if anybody's would be willing to share where they're from and who you are, would be great. Like if you're a parent or a professional, that'd be wonderful. And I'll try and answer your questions at the end. Participants today will hopefully gain an insight into common signs and symptoms of hypermobility, the ways it can influence daily activities such as self-care, school, participation and play, and how early identification can make a positive difference. This session will take a practical, accessible approach, focusing on awareness and understanding hypermobility. So I'm hoping attendees will be introduced to simple evidence-informed strategies and supportive approaches that can help children build confidence and develop functional skills and participate more fully in everyday life. So I'm hoping this will give you a bit more of an understanding and how involving an OT or other healthcare professionals could be quite valuable for your child's support and for their health. So today, this is the general layout of the session. So I'm going to do a brief introduction. I'm going to say what is hypermobility, statistics in children, strengths, common challenges, the assessments used, and when to refer to a specialist. I just want to add this disclaimer as it's just a really important notice regarding today. So the information that I'm providing today regarding hypermobility and other conditions is just a general guidance only, and it shouldn't replace any professional assessment. So all the recommendations are based on current best practice and research in occupational settings. So who's OT for me? So I work OT for me, and we believe that every young person deserves a chance to thrive in spaces that celebrate, not challenge the way their brain experiences the world. So by partnering with families and educators and businesses as well, we break down barriers and build independence and boost confidence, empowering young minds, not just for today, but for a lifetime. So we champion individuality, we create opportunity, and we transform lives. We're a really small team of specialist occupational therapists with postgraduate training in sensory processing, and we support children, adolescents, and young adults. We work with a large number of children with various different medical and health needs, and we use our PEO model, which is our person, environment, and occupational model, to enable participation in meaningful activities. And this can be whether at home, in education, at work, during play and leisure. Because as human beings, we all need to be productive and maintain an occupational balance. And when this balance is lost, it can lead to occupational deprivation, which can result in a deterioration in mental health, physical health, as well as increased risk in social, economic, cultural and spiritual areas. And I really love this lovely saying by Alexander Den Hager, where it says, when a flower doesn't bloom, you fix the environment which it grows, not the flower. So it's looking at what can we do to change around it to help it. So you wouldn't pull the leaves off or poke it or pull it out. You would nurture it, you would water it, you would change the environment to make sure it had all those needs met. So as OT for me, we very much believe in that bottom-up neurodevelopmental approach to help all that lovely fruit grow, which is basically all those abilities to do those occupations. So who am I? So I'll set the scene, I'll introduce myself, and I will be brief, I promise. I got into the health profession because I had family members who experienced significant mental health challenges, and they were often misunderstood. And this sparked my curiosity about how health, education, and the social economy influence one another, and that we are all different and we all bring our own different lived experiences. I myself, I was diagnosed very, very young with dyslexia. My professional career, I have worked, I've been an OT for over 20 years, and I've worked mainly within the National Health Service. Now I'm working OT for me. I've worked across secure services, the police, mental health, inpatient settings, colleges, schools, clinics, communities, universities and workplaces. I've supported individuals across the lifespan. I feel very fortunate to have had that as a clinician. So I've supported from babies up to adults, and I've gone from medium secure forensic services, supporting people with enduring mental health challenges, to children and teenagers who are facing burnout. At OT for Me, we support a large number of families with various hypermobility challenges, which I'll discuss today. My professional career has given me a really great wide perspective of how challenges can present at different stages in your life. I've completed postgraduate qualifications in sensory integration, which involves an in-depth study of anatomy and physiology to help me understand the assessments and interventions that I plan. I'm planning to do a master's degree in further research around sensory processing needs as well. Currently in my role, OT for Me, I'm now focusing quite a lot on, I work a lot with children, I still have my caseload, but I am doing a lot more work around working with employees and workplaces to support individuals' sensory needs and neurodiverse profiles to successfully help engage them into employment, because children will grow up into adults and will want employment. So it's very important. So what is hypermobility syndrome? So you may have heard it being referred to as extra flexible or being double jointed, but basically what it means is that our joints can move beyond the normal range of motion. So expected for that joint. So it can occur in one single joint, or it can occur in many joints. It impacts your muscle ligaments and tendons, your joint shape, and it can make them more loose and elastic. So these are some other current statistics in the UK. It's always good to refer to these. Really interestingly, the UK population study found that the girls were actually more higher likely to have hypermobility. And then this interesting statistic here is worldwide, looking about how many children and adolescents experience hypermobility. So from the literature and clinical findings, it suggests that children who are neurodivergent may have a higher chance of having co-occurring conditions such as hypermobility. So studies have reported that, so the Casanova et al. Reported that approximately 22 to 31% of individuals with autism presented with joint hypermobility. Obviously, with the ADHD study, 74% of children met the criteria for joint hypermobility compared to 13% of their typically developing peers. And with dyspraxia, also known as developmental coordination disorder, 64% of children with dyspraxia exhibited joint hypermobility, in contrast to the 33% of the control group. So it's very interesting seeing these statistics. So quite a lot of autistic children are showing obviously higher rates of joint hypermobility compared to the general population. So this may impact coordination and posture. And it's also obviously highlighting children with ADHD are more likely to have hypermobility, which is linked to motor coordination challenges and joint injuries. And dyspraxia DCD is very interesting because quite often children who are diagnosed with this condition can have higher rates of hypermobility, and again impacting on motor skill development, balance, and also injury to risk to more injuries as well. So when we talk about joint hypermobility, it's important to understand several factors that could influence how flexible someone's joint appears. So these obviously include what I've listed on this slide. So age, as children are naturally more flexible than adults. Gender, with girls often showing greater joint mobility. And ethnicity, as prevalence can vary between populations. Other key factors include muscle tone, which helps stabilize your joint, the alignment of joint surfaces, and connective tissue pliability. So meaning that basically means how stretchy the ligaments and tendons are. Additionally, neuromuscular reflex activity can affect joint stability, and coordination or training can temporarily increase that flexibility. It's really crucial to recognise these, that these are just some of the factors, and individual differences mean that hypermobility can present differently in each person. So here is a few suggestions of what children with hypermobility could be very, very good at. So this is a nice strength due to joint hypermobility syndrome. So quite often children who are hypermobile might engage in flexible based sports. So like gymnastics, it's enhanced flexibility, can help with doing the splits, back bends and other complex movements, like dance with ballet, jazz, any other types of dance. Hypermobility can contribute to that, like kind of graceful kind of movement, extended lines and fluid movement. Figure skating, it can flexibly aid spins and jumps and artistic expression. It can also be a strength in movement and flow sports. So martial arts, so they can be very good at flexibly, like can improve kicking range and fluidity of movement. Yoga, many poses could be easier for hypermobile children, though care is needed that these kids don't overextend their ligaments. You can have acrobats, so such as doing aerial work, those kind of activities. Water sports, swimming, flexibility can improve stroke technique and streamline position, and especially in strokes like butterfly or breaststroke. Other activities such as climbing can be, flexibility can help with reaching holds, manoeuvring the body in tight spaces. Some sports like horse riding can be beneficial to help strengthen their core and their posture. So these are real strengths that hypermobility can help within these specific activities. However, while these sports can be great outlets, it's really essential to focus on strength and stability and training to support joints, because you've got to consider those impacts. So you need to monitor for pain and fatigue, overstretching, especially in weight-bearing activities. So and make sure that the coach or the therapist that are working with your child understand hypermobility and they adapt their program and training according to that, so that they don't have those risks or reduce the risks. So hypermobility in young children, I've broke it down into kind of 3 areas. So quite often we would look at like the history and the early signs from family history, and obviously any early feeding challenges, constipation. You'd look at movement and skills. So was there a delay in motor development? Were they late to crawl or walk? Did they have any challenges with their fingers, that kind of fine motor dexterity? Are they clumsy? Do they have clicking joints? Is there increased flexibility? Body and energy, do they fatigue more? Do they have a poor response to healing? So when they have a cut, growing pains, do they seem to complain of growing pains, headaches, and occasional other joint pain? So some of the common changes to gait in children and adolescents with hypermobility, it basically, gait means the pattern of movement with walking, is that they can sometimes experience flexed knees. So you can see in this picture here how that knee has flexed. You can also have overpronation of joints, poor heel to toe action, and also like flexed internally rotated hips. So these are just a few. There can be more as well, but these are some of the common changes that some of these children may experience. So there are some more further challenges that children and adolescents can experience. Skin and connective tissue, because obviously that's part of it, supports your joints, and if they're super bendy, it can actually lead to more bruising easily. The skin can be a bit more stretchy. You can get more stretch kind of marks. You can have some more cardiovascular potential challenges, such as fainting more. There's also a condition called postural orthostatic tachycardia syndrome. I can never say that, POTS in short. And this is a condition where the heart rate increases abnormally when you stand up, causing symptoms such as dizziness, fatigue, and fainting. In the UK, children can be diagnosed by a paediatrician, a cardiologist, or a neurologist, but often after quite a lot of tests. So you can get a referral via your GP to look into this. But also you can get some other gastrointestinal challenges as well, such as hernia and gastric reflux. So these are just some challenges that they may experience, not all. There are some further challenges as well that these children could experience. So such as like musculoskeletal strength and stability. So that's, if you think about your body, your musculoskeletal, using all your limbs, so such as hand grip, hip adductors, hip extensors, your inner quads, plantar flexors. You've also got postural and structural some more challenges. So it could be especially in adolescences with postural changes in growth, flat feet, more growing pains. You can also have some neuromuscular and functional challenges such as poor proprioception, deconditioning, poor general fitness, and general being overwhelmed. So if you get decreased abdominal strength and type, you can get, when you get decreased abdominal strength and tight hamstrings, you can get an increased lordoidus. So you can get a bit more of, it's your lower back that can curve a bit more. And sometimes people with hypermobility can get tighter thoracolumbar fascia, which is like a sheet of muscle on your lower back. And that's really important for stabilization of muscles. You can get increased rounding of the upper back as well. Quite often with growth pains for people that have hypermobility, this can often start in early adolescence. So you can get quite a lot of night pain, is quite common, and it can be quite severe for some children, and it can interfere with their regular daily activities. And when I talked about deconditioning, this means loss of physical fitness and strength due to inactivity or reduced movement over time. So some other considerations to think about with hypermobility is puberty is a big section because it impacts skeletal growth, sexual maturation, and increased circulatory system efficiency. So that's something to be aware of. And weight increases may pose a greater risk for some individuals. So there is an increase in muscle strength and mass approximately 9 to 12 months after peak height and weight gain. And also you get a lot of hormonal influences that affect muscle strengths. And this is really critical time for children for adolescents who are hypermobile. So you might see that they might come across some of these challenges during this time. So there is an assessment tool that's widely used, which you can see here. It's a screening tool and it assesses across 9 points, and it's, if you score a 4 or more, it could indicate you might be hypermobile. A lot of clinicians can follow this. Quite a lot of GPs will use this, for instance, if you refer to the GP regarding any concerns. So if you were concerned that your child or teenager might have hypermobility, the first point of contact is to seek a professional assessment. So contact your GP or your paediatrician. A physiotherapist are wonderful in this area, and there are some physiotherapists in the country who specialise in hypermobility, and they can help with strength and fatigue management. Occupational therapy can support with that, adapting daily living skills and fatigue management as well. You can also have access to a rheumatologist, which they can help with that kinetic tissue disorders such as EDS, if that's suspected, which is a more severe form of hypermobility. And also you can consult a cardiologist if POTS is suspected and you've gone to your GP, or if there's any other autonomic kind of issues are suspected. So as an occupational therapist, for an OT assessment, I will use the PEO model, as you can see here, in my clinical practice. So the environment has a huge influence on us as human beings and on our ability to function. So we ask, is the person in the right environment to be able to perform their chosen occupation? The person refers to the individual, for example, a child, so their skills, their interests, motivations, life experiences, background, and cognition. And the occupation refers to the activity or the task that they're engaged in. So that could be education, the curriculum, could be, if it's an adult, at work, could be self-care, could be personal activities, play, leisure. And what we do as occupational therapists is that we consider the demands of the task and the skills required for that task and the expectations. So, for example, a child is being expected to learn when they're at school. So if someone is hypermobile, it could impact their motor patterns, their posture, their grip strength and fatigue. So if you think about a child at school, think about handwriting. If they're hypermobile in their hand and their grip strength and the fatigue and the pain. Think about PE when they're engaging in PE and running around doing all that lovely gross motor movements. Also sitting for long periods, how that might feel on their joints. The environment is a setting where the occupation occurs. So this includes the physical layout, the social setting, and the cultural context, and so on. So for the child, school could be, is that environment set up right for them to be able to engage in that chosen occupation? So as an occupational therapist, we ensure that the interaction between these three components fits the person. So the person's ability should align with the occupational demand and environmental conditions. So our role is to help clients regain or adapt occupations that suit both their abilities and their environment. And also, because obviously we are specialists in sensory integration, we always must consider sensory needs and safety needs within the environment as well. Because many neurodivergent children and individuals may experience with challenges with noise, light and smell. So think back to, I don't know if anyone here has attended any of my sensory processing training, but think back to that around the challenges. So that's something to consider when thinking about the environment, such as a question for you to all think about is, have you ever struggled to concentrate at work or home or school? Are you in an open plan office? Does your kitchen smell, or do the lights bother you? Do you bump into furniture? Is the door open? Is it letting lots of noise in from your corridor? So now imagine if you were living that every day, how would that make you feel? Would you be productive? Would you be able to engage in learning? Would you begin to feel unwell? So that's how important the environment is. And that could be a constant barrier for someone working to their full potential. So always think about, is the environment supporting their ability to function before you start labeling that person or child as disruptive or difficult or underperforming? Have we got the environment right? Have we got the occupation right? Is that supporting that young person? So these are just some top tips from me. These are just general ideas and strategies. They're not specialist interventions. They're just simple things to consider if your child has hypermobility. So routine is really important. So establishing that consistent daily routine helps manage energy levels. So just build in time of the day to relax, especially if your child is reported that they're feeling tired. Rest and movement. So alternate between periods of rest and gentle movement to prevent any fatigue and support that joint mobility. Remaining in the same position for too long can increase stiffness. So like for me right now, I will definitely need to go up for a walk after this talk to change my position. But then again, if you're doing too much movement, it can lead to overexertion on the joints and can cause pain and fatigue and take longer to recover. Sleep is really important. We need to all maintain a regular sleep schedule. So to create a restful environment with muted colours, low lighting, soft materials for sleeping, reduce screen time before bed, because that the light that's emitted from screens can suppress melatonin, and that's the hormone that helps us know when we need to go to sleep. And avoid stimulants such as sugar and caffeine before bedtime. Having an active day following these points above gives the body the right signals to sleep at the end of the day. Reduce extension. So when moving past the body, please be aware of overextending, as this can increase strain on the joints. For example, activities that require reaching and stretching, such as when we talked about climbing or like washing your back, or if a child's having to do kind of bottom wiping, consider using some tools to reduce that strain and that bending. Posture. So please be aware and maintain proper posture during activities to reduce that strain. The muscles in the body's core are often a bit weaker, so carry gentle exercises out to build up that strength, and you can do that little and often. Building muscle up around the joints, so strengthening muscles around the joints provide better support, and it reduces risk of injury and improves endurance. So there's lots of fun things that children can do, such as like Superman pose, little push-ups, crab walking, back bridging, and some of these are naturally built into the school day, like sensory circuits, movement breaks. So like little and frequent breaks like that are really good. You can do some finger strengthening activities, so using therapy, stress balls, popping bubble wrap, fidget toys, hand grippers, and that helps improve that kind of the finger strength and the dexterity. So water-based activities are great. These can provide low impact exercise, and that engages the whole body, and it also helps enhance that proprioception because you're getting that lovely warm compression from the water, which is helping you with that body awareness, and it helps reduce joint pain and stiffness as well, especially hydrotherapy pools. They're particularly good for that because they are a warmer temperature. And lastly, sometimes when you see a professional such as a GP or your paediatrician, you might then be referred to an NHS OT or physio who might provide you with some supportive aids, such as kind of splints or certain types of equipment to help stop that kind of overbending of the joint as well. So we at OT for Me support many children and adolescents who have joint hypermobility syndrome and other related conditions. We also support kids who have the more severe form of hypermobility, EDS, and also children that have POTS. When we are working with and supporting these children, we put recommendations in place to support their development and their engagement at home and school and within the wider community. And that includes reasonable adjustments that need to be supported just to help with that medical condition. So we do the occupational therapy functional assessment, and sometimes we might look at the sensory processing alongside that as well. We do a lot of environmental audits as well, where we can go and look within schools and other places to look at making some simple changes to make the environment more inclusive, but also help in support that engagement as well. And that can be making some suggestions from the sensory perspective, the occupation, or if they're needing a bit of equipment, so some kind of adaptations as well. Also, there is opportunities for like treatment as well. So we've supported a lot of children in supporting them with their own functional goals, what they would like to work towards, such as children wanting to be able to tie their shoelaces, to zip their coats up, to be able to handwrite better, to be able to scoot, to be able to ride their bike better. So there's lots of functional goals that we also work on as well. So I hope you found today useful. It is just a general discussion about hypermobility, what it is, what the impact might be, and when you should definitely seek out a professional assessment. Always go to your GP for the first point, and to get to see if they can do the hypermobility assessment with you if you have any concerns. I hope it's been helpful, and yeah, if you have any questions, I'm happy to now have a look at them within the group chat and see if anyone needs anything answering. So I'll take a little look now. Let's see. Let's have a little look. Oh, great. I can see there's quite a few people here. Ah, right. I'm going through it. Okay, Tracy, you have hypermobility, EDS, and myotonic autistic is, yes, hypermobile. We see that a lot, especially with a lot of the families that we support. And a lot of what we're doing at the moment, I'm working with one particular family, is around getting more of an occupational balance for this young person. So we are looking at fatigue management because this young boy that I'm working with has EDS and autism, and it's about not over exerting himself, but also giving him opportunities into interests that he actually wants to do, so that he's not occupationally deprived, spends quite a long periods of time in his room, and actually he's got a lot of activities he wants to engage in, but he's just so exhausted. So we're looking at ways of building his routine, looking at his timetable, but also looking at when he's feeling more regulated or when he needs more downtime, and recognizing those symptoms as well. So as an OT, I'm working around that to help him and his family embed that, to enable him to participate more in fulfilling occupations as well. So yeah, it's very, we're seeing it an increase with more children coming through with hypermobility, and I can see someone's here from a clinic who sees a lot of hypermobility garments. There are some great garments out there. I've worked with several different companies around different kind of sensory orthotics to provide a bit more core stability. But again, you need an assessment. You need to probably have either your occupational therapist or your physiotherapist with the company, and you can try these different types of garments on to give that simple stability. Sometimes it can be as simple as just a hip stabilizer, which can massively help with somebody's gait and walking. It can be just some kind of some orthotics around hands to help with pain management and stability of joints, so they're able to they're able to write longer without being in pain. So those garments are fantastic. And yes, I'm pleased to see someone's on from one of those companies. I'm just checking I'm not missing anybody. So apologies if I miss anyone. I'm going through all the chat now. Yeah, oh great. I'm pleased to hear that, Tracy, that you've seen Bev. That's lovely to hear that things are going well with you, OT, for me. What advice would you give for safe sensory strategies for someone who's hypermobile, seeks strong proprioception? Yeah, a joint compressor mass safe, or is it best to ask physio? What deep pressure garments recommend? So Catherine, I definitely would recommend an assessment. Always start with a really good comprehensive assessment to really understand exactly what's happening, because it would be good to pull that apart. Because if you've got hypermobility and you seek a lot of prop, there are definitely ways to do that safely, definitely. Swimming is a really nice one, using a hydrotherapy pool because it's warmer. So it can ease like joint pain, and also you get that lovely resistance from the water. I've never heard of compression massages. That's quite interesting. But I would definitely, you can get garments, such as there's a lady who's here on this webinar right now, who they have those type of garments. If you did get deep pressure garments, you can get your physio or your OT to join you on the appointment to trial different types of garments, because the good thing about a comprehensive assessment is finding out what parts of his body need stabilizing a bit more, and also how long to wear it for, because there's risk factors around that, because you need time out of it and in it to make sure that he has this natural time for his body, so it's not wearing it all the time. So there's quite a lot of assessment that needs to happen around that, but I definitely would recommend an assessment, and especially if he's got quite a lot of proprioception, definitely get an OT that's fully certified and qualified in sensory integration to kind of help you unpick that a little bit more, because there's a lot that you can do in intervention around that, and also providing support to families at home. So I definitely would do that. It's a very interesting condition, and I think interestingly presenting this today, it reminds me of how we sometimes some people really underestimate, I think, how hypermobility can impact function, and we focus on other things, and I think it's really important to bring it, to highlight it and discuss it, because actually just because you can't see it doesn't mean it's not there, and sometimes it can be quite subtle, and it's having a really good comprehensive assessment to understand that, and then actually what treatment can you put in place to help that young person manage that condition. So yeah, it's okay, another, so I'm just reading the chat as we go. What advice would you give to youth walkers supporting teens with POTS in an energy deficit? The young person likes digital media but too exhausted to engage in much. Yeah, it's a real challenge. I've worked with a lot of children with POTS, and a lot of it is around, we've done a lot of interoception work actually with these types of presentations around helping the young person understand what's actually happening inside their body, and noticing to those homeostatic kind of signals and emotion and effective emotions, because quite often sometimes children with POTS can struggle with that. So we work around how their body's feeling, and then we kind of develop a bit of a, what does my body feel like? And then from that, we can create their own kind of sensory ladder, or their own kind of energy ladder. And then they can start recognizing, today I feel like this, and I feel like I can do this and this. But knowing how long, and I would grade that activity. So I'd do it for a little amount of time, and then I'd then structure in a bit of a rest break afterwards. So a lot of it's kind of working in collaboration with the young person to help them take a little bit of ownership to understand that. It could be that some of your teenagers might need, Alicia, they might need a bit more of an in-depth assessment of it, just to have a look at it. We can help with that in terms of occupational therapy, looking at grading the activity and looking at building a routine that we can then hand on to the youth workers to support. Because again, like you said, a lot of people might like to do more digital media, but actually it's really important to move as well. And I suppose it's looking at what's highly interesting and motivating for that person to engage them, but also giving you guys the tools to help you manage that, so you can support them as best you can. Yeah, Tracy, you're right. There are many co-occurring conditions, and it makes it really complicated. It really, really does, especially in EDS. Yeah, I agree, definitely. I have, yeah, and it's really, really tricky. And if you think about the hormonal element that we discussed, especially teenagers, so all those changes in the body, and especially if someone has POTS or is hypermobile, and potentially has autism, that autistic individual, that can be quite a lot what's happening inside their body. And I think it's about looking, isn't it, and kind of supporting them around that, around helping them manage it, because it's very difficult for them, and a lot of difficult physical challenges. I worked with a young lad that very much presented the same way, who became very breathless and feeling really faint. And what we had to do is slowly build up his kind of tolerance in our session. So it just started with me just sitting on a beanbag with him in the session. And then over time, we did different types of sensory input to help get him to that lovely, just right state. So then he was able to do a little bit of engagement, but then not overexerting it. So it's very much a journey, and every child's very different. And you have to be led by them, and always have, whenever you engage with any professionals, always make sure you have really clear functional goals, in terms of an OT anyway, of what you're trying to achieve, and what you're trying to improve as well. That's really important to have those clear clinical goals. So yeah, it's a very interesting condition, and it's also thinking about supportive kind of chairs, rise desks as well can be quite helpful as well. So the desks that can go up and down, just taking like those breaks, going for a walk, having a rest. There's a lot of kind of strategies that you can naturally embed, into everyday activities. So yeah, that's kind of my clinical discussion with you guys today. I hope it's been helpful for you. Thank you for everybody that's engaged in the chat. It's a really interesting topic, and this is why I'm quite keen to talk about it, because it's not talked about as much, and I feel like it's something that we're seeing more as clinicians in terms of hypermobility and POTS for definite, and yeah, there's definitely a need to more support that. So yeah, I hope that's been helpful, and I appreciate any feedback. Please feel free to send it, or follow our newsletter for any upcoming dates. We've got free monthly webinars from now, I think, until next September, so please keep your eye out as well. So thank you very much. I think that's it for me today, and I'll let you all get on with your day, and thank you for joining me. And yeah, please return to future webinars.